Chapter 3, Lecture 2. Let's continue with economic analysis techniques. In the previous lecture, we talked about the cost analysis, limitation, and advantages. The advantages of cost analysis is that it's simply we are comparing the cost when we have a limited budget. We wanted to know if we can afford the cost of a specific project. And most of the time, we use it when we assume the outcomes of different projects are the same, the benefits are the same, and only we wanted to compare the costs, which usually never happens. Most of the time, the outcomes and benefits are different and should be evaluated. So therefore, we need another economic evaluation to compare both costs and benefits of undertaking different projects. Cost-benefit analysis is a type of economic evaluation techniques that compares both costs and benefits of programs, different programs basically. The benefit can include both costs and benefits are basically compared in monetary values, the same actually unit index, which is easy to compare. So benefit can include the value of better health, usually measured by cost of disease averted, and increase productivity, often measured by earnings or reduce sick days. So we can actually compare the program savings. So, for example, you're deciding whether providing free flu shot for your employees is cost benefit for your basically for you or not. In that case, you actually have to list out all the costs for providing free flu shot, and also you have to convert all the benefits in terms of providing free flu shot for your employees in terms of monetary value, and then compare the cost and benefit. So usually by providing free flu shot, you may actually basically reduce the sick days of your employees, and then you can actually convert that in monetary term and then compare to the cost of providing flu shot for employees and evaluate the program savings. So cost and benefit both expressed in monetary value, and then you compare the cost and benefit, and if the benefit exceeds the cost, so do it if the benefit is greater than cost, and don't do it if the cost is greater than benefit. Now usually the optimizing rule in public policy, you have to list all the expected benefits of taking that particular choice or activity or a project, and list all the costs, expected costs of taking that a specific project, and then the subtraction of these two gives us the expected net benefit of undertaking that a specific project. If the expected net benefit is greater than zero, then you choose that project or you reject it. We call that expected benefit and expected cost because we don't have the full information about all the costs and benefits, and we only have limited information about the about the implementing a specific project. So therefore, we only can list the expected benefit and expected cost of undertaking any specific project, and make a decision based on the expected net benefit of the subtraction of these two. And if the expected net benefit is greater than zero, you choose the project. Now, in the public policy, we look at all the uh, costs and benefits. So we call that the total social benefit and total social cost. And you wanted to maximize the total net social benefits, which is the subtraction of the total social benefit and um, subtraction of the total social cost from the total social benefit gives us the total net social benefit. And you wanted to maximize that, means that you wanted to basically produce up to the point and consume up to the point that the differences between these two is at the maximum point. So how we can look at that? We look at the so that's one way of making decision. You look at the differences in this format. The other form is look at the ratios. The usual summary measure is the benefit cost ratio. So you look at the ratio of the benefit and cost in one basically this unit monetary terms, and then you make a decision if the benefit exceeds the cost when the ratio is greater than 1. So definitely we want the benefit cost ratio to be greater than 1, because if it's a smaller than 1 means that the cost exceeds the benefits, and if it's equal to 1 means that the rate of return on the investment is basically equal to 1. We don't gain anything. If the ratio of 2, basically the ratio of 2 means that for every $1 spent on the program, there is a $2 return on investment. So therefore, this seems very good, unless we have another project that the return on investment is $3. So therefore, we have to choose the other project. So it depends on which project has the highest return on investment or return in benefit. If we wanted to show that graphically, the efficient level of output is where we maximize the total net social benefit. Means that the subtraction between the total social benefit and total social cost, the differences between these two gives us the efficient level of output, and where this difference is the biggest one, which at this time, at this point, is this Q 0 or Q naught, is actually the maximum differences between total social benefit and total social cost. Let's start from the beginning. In the vertical axis, we have the cost and benefit of medical services. In the horizontal axis, we have the quantity of medical services, and the total social cost of producing medical care is upward sloping. Means that because total cost is increases as more medical care is produced. And then the curve both outward, toward the vertical axis, because the marginal cost of producing medical care is increases as more medical care basically produced. So this is the slope of the or marginal cost, which is the slope of the total social cost. The total social benefit curve is increasing in decreasing diminishing rate because of the diminishing marginal benefit. So each additional basically benefit of medical care is increasing, but in decreasing rate because of diminishing marginal benefit, that we talked about that in previous chapter. So again, the slope of the total social benefit gives us the marginal social benefit. So you wanted to maximize this distance if we use the subtraction format. So the total net social benefit is maximized when the vertical distance between the two curves is greatest, and that occurs at the Q dot or Q naught level of medical services. So the efficient amount of medical services, the marginal social benefit curve, is negatively sloped because of diminishing marginal benefit, and marginal social curve is positively sloped because of increasing marginal cost. So the efficient amount of medical services as Q naught is where the marginal social benefit and marginal social cost is actually equal. So means that the slope of the marginal social benefit and marginal social cost are equal, which actually is the one is where the subtraction of these two gives us the maximum amount of total net social benefit. So if we wanted to show the marginal social benefit and marginal social cost, so we can actually show this graph. In the vertical axis, we have the cost and benefit of medical services. In the horizontal axis, the same thing. We have a quantity of medical services, the same vertical and horizontal axis as the previous graph. The only thing changes here, we are looking at the marginal social benefit and marginal social cost instead of looking at the total social benefit and total social cost. The marginal social cost curve of producing medical care is upward sloping because of the increasing marginal cost. So the marginal social benefit here is decreasing. It's downward sloping because of the notion of diminishing marginal benefit. Now, the intersection of these two is the Q naught that we had in the previous graph. As a total net social benefit is maximized as Q naught level of medical care, where the two curves intersect at this point. So the at the maximum level of social benefit, total net social benefit is at this point. Before that, production is actually the marginal social benefit is greater than marginal social cost. So we have to increase the quantity of medical services, because up to the point the marginal social benefits is equal to the marginal social cost, and above that, by increasing producing more of that medical services, the marginal social cost is increasing, and this distance are becoming greater and greater, means that we are basically our costs are increasing and our benefits are decreasing because of diminishing marginal utility. So therefore, there is no point of increasing the medical services, and this is the optimal point we have to produce. So if Q1 amount of medical care is produced, then the marginal social benefits exceed the marginal social cost, and society would be better off if we produce more of the medical care. Up to this point, still the marginal social cost is greater than marginal social benefit. Any production after this point, we are basically losing value, losing money, because the marginal social cost is greater than marginal social benefit. Means that our society is not benefiting with any additional more of medical care, and we have to stop at this point. This is the optimal point of producing medical services. So the net marginal social benefit of production of the medical care is equal to the marginal social benefit minus marginal social cost of producing consuming a additional unit of medical care. If the net marginal social benefit is greater than zero, means that still the marginal social benefit is greater than marginal social cost. We have to continue. So the total net social benefit increases if an additional unit of good is consumed. So in that case, we continue to consume more up to the point these two are equal, and therefore any additional consumption makes this greater than this and makes this negative. So therefore the net marginal social benefit becoming less than zero if the with consuming more medical care after the optimal point, and the society is made worse off if an additional unit of good is produced and consumed. Now, so the practical side of using cost-benefit analysis is that for healthcare decision makers, I would say benefits or diverted cost of the medical interventions. We look at the four broad categories. The medical cost diverted because of an illness is prevented, or so basically we look at the monetary values of the illness illness is prevented, the death is postponed, or good health is restored, or continuation of a life or better health, or both basically. um, you know we are looking at the satisfaction from a better quality and quantity of life in monetary value. So the advantage of cost benefit analysis is that we evaluate both costs and benefits in money terms, and so therefore this is a powerful tool that can help us to answer the question of whether or not to fund the program. And even if we have a few programs we wanted to compare, we can compare either the ratio or subtraction in terms of benefit cost ratio, or the net cost benefit ratio, social cost benefit, and then make a decision by comparing different cost benefit ratio of different projects. Now, the limitation of the cost benefit analysis is that both costs and benefits are in monetary value, so therefore sometimes it's difficult to place a dollar value on the outcomes. For example, what is the value of health? What is the value of the human life? And then so it's sometimes is not ethical to put a value in the human life, and then decide about whether to undertake any project or not. It's not ethical. So to avoid placing a dollar value on benefit, then we have to use the cost effectiveness analysis.